Okay, so starting the final assessment project and going to 60 for the rules, per the rules. Okay, nothing there, nothing there. Okay, these are the equipment, my stethoscope, pen light, Q-tip, keys, and the piece of paper for the test. Okay, I'm going to be beginning shortly. Okay. Knocking on the door. Hello, my name is Matthew. I'm a nurse. I'm going to be doing a head-to-toe physical assessment with you. How are you today?
I'm doing okay. How are you?
Doing well, doing well. Can you tell me your full name, your name and date of birth?
Sure. KG is 092489.
Okay, all right. So, right now I'm observing the hairline, symmetrical, no issues noted. Observing the skin, no issues on head or neck. Going to ask the patient to palpate the arms and legs. Is it alright if I examine your arms and legs?
Yeah, of course.
Okay, just going to. No issues noted. No issues noted on the lower extremity. Okay, all right. Looking at patient's eyes, ocular exam, no issues noted. Going to palpate the upper lid and lower lid. Is it alright if I touch your eyes on the upper and lower?
Yes.
Okay, all right. Palpating, no issues noted, no issues noted. Okay. Now I'm going to use I'm going to use a pen light to test your eyes. Is that okay?
Yes.
All right. Okay. Pupils equal and reactive to light with accommodation. Okay, next. I'm going to take a look up your nose, nares, okay?
Mm-hmm. Do I need
nares normal. Now just going to, and the nose is symmetrical as well. Okay. I'm going to ask you to open your mouth, okay?
Okay.
Mucosa is pink. No irregularities. Can you stick out your tongue? Down, up, left, right. Good. Thank you so much. Okay. Okay, now I'm going to palpate the frontal sinus and maxilla sinus. Sorry if I touch your face really quick.
Sure.
I'm just gonna examine here and here. No irregularities noted. Now going to check the lymph nodes of the facial lymph nodes. Just gonna check your face real quick. Facial lymph nodes, cervical lymph nodes, no masses. And can you lift up your arms for me really quick?
Of course.
And no axillary lymph nodes noted. Okay, all right. Okay, I'm just gonna check your pulse. So I'm checking the carotid arteries one by one. Pulse noted. Pulse noted. Now I'm going to check the brachial pulse. Just gonna check your pulse here.
Okay.
Positive brachial pulse. Okay. Positive radial pulse. Okay. Just gonna check both behind your knees.
Okay.
Positive popliteal pulse. Positive tibial pulse. And positive dorsalis pedis pulse. Okay. All right. Okay. So next thing I'm going to do. Okay. So now I'm gonna check the lower extremities for any edema. I'm just gonna touch your legs here.
Okay.
No edema noted, and no upper extremity edema noted. Okay. All right. So now I'm going to listen to our heart sounds. Just gonna listen to your heart, okay?
Okay.
Okay. So listening to the listening to the tricuspid valve, listening to the pulmonary heart sounds, mitral, tricuspid, and all lung sounds, all heart sounds present. Okay. Okay. All right. Gonna take a second. Okay. All right. So now I'm going to do the respiratory part of the exam. Okay, I'm just gonna put my hands on your chest and I'm just gonna ask you to say 99 when I touch.
Okay. 99. 99. 99.
Okay. Now the posterior.
99. 99. 99. 99. 99.
No irregularities noted. I'm just gonna percuss the area now. Okay. No unremarkable, no irregularities. Okay. All right. Okay. Okay. Now I'm going to listen to the heart sounds with the, instead of the diaphragm, I'm going to listen with the bell. Okay. Okay. Listen to tricuspid, pulmonary. Okay. Mitral. Okay. All right. No issues. Okay. So now I'm going to listen to to her lungs. So I'm going to listen to your lungs, okay?
Okay.
All right. You can breathe naturally. Breath sounds are clear bilaterally. Now I'm just going to listen to your lung sounds here. I'm just going to ask you to breathe, okay?
Okay.
Take a breath. Okay. Take a breath. Take a breath. 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 Okay. Breath. Thank you so much. Okay. All right. Moving on. So now I'm going to listen to, I'm actually going to have you lay down if you could. And I'll be listening to her aortic artery, her femoral artery, and the aorta. Okay, just gonna take a listen.
Okay.
Okay. The renal sounds of it, renal arteries noted. Femoral arteries noted. And aorta noted. Okay, now I'm just gonna listen to them with the bell. No abnormal findings there. Okay, so now I am observing her abdomen. Okay. I'm going to percuss, starting with the right lower quadrant. No dullness, right upper quadrant, left upper quadrant, left lower quadrant. Now I'm going to lightly palpate. Now I'm going to ask my patient if they feel any tenderness when I do a hard, moderate palpation. Okay, I'm going to just push down on your abdomen. Let me know if you feel any discomfort or pain, okay?
Okay.
Any pain?
No.
Okay.
No pain.
All right. Anything?
No.
Okay. I'm gonna listen to her abdominal sounds. Right upper quadrant, then the right lower quadrant, then the right upper quadrant, left upper quadrant, and left lower quadrant. So it's positive vowel sounds in all 4 quadrants. Okay, alright. Okay, now I'm gonna have you turn on your side if you could too.
Sure.
Yeah, and I'm just going to assess for any RVA pains. Okay? Let me know if you have any tenderness, okay? Any tenderness?
No. No.
Okay, alright. Okay, alright, so I'm gonna, oh yeah, thanks. Okay, so we're gonna have you, I'm gonna have you sit back in the chair if you could.
Of course.
Thank you so much.
Yep.
Okay,
Sorry.
okay. Alright, so now I'm going to check her cap refills for her fingers and her toes. Okay. She has +1 cap refill, and the toenails are painted, so I'm unable to assess. Okay. All right. So I'm looking at her musculoskeletally and no observations out of the ordinary. I'm going to ask you to raise your shoulders, lower them, bring them out, bring them down. Okay. Now I'm going to put my hands on your shoulders and I'm just going to ask you to push up. Okay. All right. Positive strength test. Lower. Positive strength test. I'm going to put my hands on your neck. Actually, beforehand, I'm going to have you lift up, look up,
Okay.
down, bend to the left, bend to the right. Okay. And so all I'm going to do is I'm going to put my hand here next to your face and just bend against. All right. And bend. All right. Okay. So now I'm going to do that with your shoulders. Can you lift up your shoulders?
Of course.
All right. And I'm going to put them down here. Pull down. All right. Strength test pass. Okay. I'm going to have you put your hands out. I'm going to observe her elbow range of motion. Can you circle your elbows? Then up, down, out, and in. Awesome. All right. So strength. Range of motion passed. Okay. So you can put your hands out. Okay. So up, down, out, in. So wrist full range of motion. I'm going to put my hands here and ask you to push up. Okay. Push down. Strength test passed. I'm going to hold your hands. Pull towards you. Push towards me. Lots of strength. All right. Okay. So next what we're going to do is I'm going to have you stand.
Okay.
Okay. So we're going to do a hip forward. Leg forward like this.
Okay.
Testing the hip strength, the hip range of motion. Back. Then out. And then in. Yeah. And then other side.
Okay.
Out. Back. Out. And in. Positive range of motion. Okay. You can see. Okay. All right. So I'm gonna move my legs here. So you're gonna move your legs up, down, out, and then in.
Both at the same time?
One than the other.
Okay.
Please. Okay. Go ahead. Back. Out, in, okay, and then up, down, out, in, and so I'm going to put my hands here and I'm going to just have you push up, okay, positive strength test, and put one, positive strength test fast, okay, so now with your feet, we're going to do the same thing, it's going to be up,
Yep.
down, in, out,
Okay.
okay, up, down, in, out, range of motion passed. Just gonna put my hands here, push down, push up, and push down. Strength test passed. Okay. 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 All right. So, next, what we're going to do is I'm going to have you touch your hands to your elbows, to your elbow, right and then left. Okay, take your leg and then you're going to use your heel to go down your shin. Heel down your shin. Good. Okay, so raise your eyebrows if you could. All right. Squeeze it, close your eyes tightly. Okay. Clench your jaw. Okay.
Sorry.
Move your jaw left or right.
Oh wait, I went the wrong way.
Wiggle your jaw. Yep. Okay. Puff your cheeks. Okay. Purse your lips. Okay. All cranial nerve tests passed. I don't think there's any other cranial nerve. I think so. Okay. All right. So now I'm going to do dull sharp test. Can you close your eyes for me, please? And tell me if this feels dull or sharp. Okay, I'm just gonna drag across your face.
Dull.
Okay, let me try it one more time.
Sharp.
Okay, alright. Okay, alright. Now?
Dull.
Okay. Alright, I'm gonna do the same test on her arms and her legs. Okay.
Sharp.
Okay, next.
Sharp.
Yes. Alright. Go ahead.
Dull.
Yes. Alright.
Sharp.
Okay. Alright. Okay.
Sorry, the first time confused me.
It's okay, no worries. Okay, so we're gonna do this on her shins, okay?
Dull. Sharp.
Okay, next. Alright, then we're gonna do it on your other leg.
Dull. Sharp.
Okay. Alright, so I'm gonna have you count down from 100 by 7. Okay?
Oh wow, okay. Okay, 193, 193, 86, 79, 72, darn it, 72, 63? Is it no, not 63, sorry.
No worries.
65.
Yep.
52? No. 58. 51.
Okay, that's
sorry,
good. That's good. No, that's good.
I'm really tired. I'm
no,
sorry.
no worries. No worries. That's quite enough. Okay, so I'm gonna have you remember 4 items. Okay.
Okay.
Okay. Apple, orange, square, rectangle. Okay. Can you repeat them back to me?
Apple, orange, square, rectangle.
Okay. Can you count down from 20 to 1 to 0?
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay. Can you tell me the 4 items that I mentioned before?
Apple, orange. Oh, nope, I can't. Sorry. I have my shapes mixed. I know their shapes. Can we do it again?
Yes, that's fine.
Okay.
I'll give you different items
Okay.
though, okay? Alright, so it's going to be
Wait, I think I remember.
Okay.
Is it okay?
Yes.
Apple, orange, square, triangle.
Great job. Great job. Okay. Alright, so I'm gonna hand you I'm going to draw something in your hand,
Okay.
and if you could tell me what I'm drawing. Okay.
If it's like the number 8.
That is correct. It is number 8. I'm going to ask you to close your eyes.
Okay.
Okay. And I'm going to put something in your hands. Can you tell me what they are?
Keys.
Okay. All right. Good. Okay. All right. I'm going to hand you a piece of paper. I need you to read it and follow the instructions for me, okay?
Okay. Do I need to read it out loud?
Yes, you can read it
Okay.
out loud. Oh. Sorry. Actually, you would read it to yourself and then.
Okay. Thank you.
Okay, so the instructions said to place paper in left hand, fold it, and then put it on the ground. And she did that well. Okay, so I'm gonna ask you to tell me about your last birthday.
Sure. I had a birthday party at my friend Stacy's house with a bunch of friends, and we danced and had a special meal. It was really fun.
All right. Long-term memory check passed. Okay. All right. And can you tell me your name? Oh, the initial.
Mm-hmm.
Can you tell me your name?
Oh, sure.
Yeah.
KG.
KG. Okay. All right. Can you tell me the date today?
Sure. Today is Sunday, August the 7th.
Okay. And what state are you in?
Massachusetts.
Okay. All right. And let's see. I'm just gonna make sure that I haven't left anything out. Okay. All right. Thank you very much, and you have a good day. Okay.
Sure. Thank you.
Concluding exam.